Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's to come. The first day of school, going to a job interview, or giving a speech may cause most people to feel fearful and nervous. But if your feelings of anxiety are extreme, last for longer than 6 months, and are interfering with your life, you may have an anxiety disorder. What do we mean by anxiety? Before we start, we have to know that there is two major types of anxiety. The first one is the occasional anxiety, which is an expected part of life and which is normal to feel, because you may feel anxious when facing a problem at work, taking a test, or before making an important decision. Our concern is the anxiety disorders, which involves more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and go worse over time. The symptoms can interfere with daily activities such as job performance, schoolwork, and relationships. So, what are the types of anxiety disorders? There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, and various phobia-related disorders. Starting with generalized anxiety disorder. People with generalized anxiety disorder (JIP) display excessive anxiety or worry most days for at least 6 months about a number of things such as personal health, work, and social interactions. Panic disorder. People with panic disorder have recurrent and unexpected panic attacks. Panic attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes. Attacks can occur unexpectedly or can be brought on by a trigger, such as a feared object or situation. Phobia-related disorders. A phobia is an intense fear of or to a specific object or situation, although it can be realistic to be anxious in some circumstances. The fear people with phobias fear is out of proportion to the actual danger caused by the situation or object. What are the symptoms of anxiety? Anxiety feels different depending on the person experiencing it. Feelings can range from butterflies in your stomach to a racing heart. You might feel out of control, like there is a disconnect between your mind and body. Other ways people experience anxiety include nightmares, panic attacks, and painful thoughts or memories that you can't control. How is anxiety disorder treated? Anxiety disorders are generally treated with psychotherapy, medication, or both. People should work with a doctor to choose the treatment that is best for them. Starting with psychotherapy. Psychotherapy or talk therapy can help people with anxiety disorders to be effective. Psychotherapy must be directed at the person's specific anxieties. Anti-anxiety medications. Anti-anxiety medications can help reduce the symptoms of anxiety, panic attacks, or extreme fear and worry. And we take, for example, benzodiazepines, which take effect more quickly than antidepressant medications. What natural remedies are used for anxiety? Lifestyle changes can be an effective way to relieve some of the stress and anxiety you may cope with every day. Most of the natural remedies consist of caring for your body, participating in healthy activities, and eliminating unhealthy ones. This includes getting enough sleep, meditating, staying active and work out, and eating healthy diet.